مساء الخير، أهلا بكم في هذا اللقاء. وستقدم الورقة الدكتورة دادو من سوريا بعنوان Neurosteroid Treatment for Postpartum Depression and Beyond. تفضلي دكتورة
شكرا حكيم. السلام عليكم ورحمة الله وبركاته. أسعد الله مساءكم جميعا. اليوم رح نحكي عن واحد من أهم التطورات الحديثة في علاج الاضطرابات المزاجية المرتبطة بالهرمونات، وخاصة الاكتئاب ما بعد الولادة. العنوان مثل ما سبق وذكر الدكتور وليد هو Neurosteroid Treatment of Postpartum Depression and Beyond. يعني إنه ما رح نناقش بس دور الستيرويدات العصبية في علاج الاكتئاب ما بعد الولادة، إنما رح نستعرض كمان كيف ممكن تمتد هالعلاجات لاضطراب مزاجية تانية مرتبطة بتقلبات الهرمونات مثل الBMDD والاكتئاب المحيط بالثدييات. الورقة بداية هي عبارة عن جيست إديتورال، يعني هي منشورة في المجلة البريطانية الطب النفسي العام 2025. هي ما دراسة أصلية، عبارة عن تحليل وتفسير من خبيرتين بالطب النفسي، وبتعرض رؤية شاملة تجمع بين البنية البيولوجية والتجارب السرية والتطبيقات المستقبلية. راح نبلش إن شاء الله. General Introduction. Perinatal depression encompasses depression during and after pregnancy. It affects approximately 14% of women worldwide and is one of the most significant complications of childbirth, with effects on mothers, reduced functioning, poor bonding with the child, and difficulty breastfeeding. It affects also on child, long-term effects on cognitive, social, and emotional development, and up to a 7-fold increased risk of depression by age 18. It affects on safety by increased suicide. Suicide is one of the leading direct causes of maternal mortality in the first year after birth. The treatment gap was clear. SSRIs were effective but required weeks of use, and many mothers were hesitant to use them due to breastfeeding or the slow rate of improvement. This highlighted the need for a fast-acting treatment that targeted the biological mechanisms specific to the postpartum period. The scientific basis. Why neurosteroids? Allopregnanolone is a neurosteroid produced by the brain and peripheral glands, uterus, placenta, and adrenal glands. It acts as a positive modulator of GABA-A receptors at the following levels: synaptic receptors, phasic inhibition; extrasynaptic receptors, tonic inhibition. The prenatal period is associated with a significant fluctuation in allopregnanolone levels. Women prone to postpartum depression have impaired GABA-A receptor sensitivity to these changes. This observation supported the hypothesis that impaired neuroadaptation to the sharp drop in allopregnanolone levels after childbirth is a key contributing factor to BPD. Therefore, using a compound that directly reactivates GABA-A receptor may lead to rapid improvement. Brexanolone, the world's first biologic target treatment for postpartum depression. Key studies. First study is a proof of concept. For patients, very rapid response within 60 hours. Phase 2, Lancet 2017. 21 patients with severe depression with the Hamilton Depression Score is higher than 20. A 21-point reduction compared to 8.8 with placebo. Phase 3, Lancet 2018. 2 studies, 246 patients. Significant improvement within the first 24 hours. Response persisted for a full month after infusion. Method of administration, 60-hour continuous IV infusion. Side effects, drowsiness, dizziness, and flushing. Rare risk of oversedation or loss of consciousness lead to the REMS program. Challenges, very expensive, requires hospitalization, limited availability. In rare cases, excessive sedation has necessitated a dose reduction. For this reason, the FDA requires a risk evaluation and mitigation strategy to ensure medical monitoring during infusion. Despite its effectiveness, its use is limited due to the high cost and the difficulty of intravenous administration. The company announced it would be discontinued in 2024 to focus on zuranolone. Zuranolone, first approved oral treatment for BPD 2023. GABA-A BAM, administered for only 14 days. Represents a breakthrough because it doesn't require hospitalization or close monitoring. Key studies. Proven trail, 30 milligram dose for 14 days, significant improvement for day 3 and continued through day 45. Skylark trail, 50 milligram dose, rapid improvement from day 3 with continued effectiveness for 6 weeks. Compared to SSRIs, 2024 study on real-world data. Zuranolone outperformed SSRIs with significant improvement from day 15 through day 45. Why does zuranolone work in BPD but fail in MDD? MDD trials have shown mixed results. This supports the hypothesis that BPD is a specific biological condition related to a disorder of adaptation to pregnancy and childbirth hormones, while MDD is broader and more biologically diverse. This suggests
راحت للصورة presentation راح العرض.
sorry. بس ثانية دكتور. دكتور وليد، كأنه النت عندي شوي ضعيف، ما عم يدخل من على اللابتوب. ببعت لك الملف تعمل له
لا
برزنتيشن شو
لا،
بدك؟
هلا ما كان راح الكهوز. هلا بدخل.
امم
مم. اعمل
يلا.
شير.
لسه ما دخل على اللابتوب، هلا من الجهاز داخل بس من اللابتوب
طيب
لسه ما دخل
ابعتيه ابعتيه لي.
الزوم. تمام يلا.